Hey guys, it's Dr. Diaz again with Untitled Chiropractic and Rehab. We have Jose here. So he's here, comes in with a little bit of low back pain. You saw during analysis as we were kind of analyzing the low back. We've discovered that a lot of this may come from some of his postural positioning. So we have some bilateral, he doesn't have pes planus or flat feet just upon standing, but his shoes are rotated inward. And as he stands up, he's starting to show signs of his foot wanting to drop. So we have discovered that he's tried orthotics before. They just don't really feel comfortable in a shoe. As we're assessing, we're discovering that it's that internal roll that may be causing his low back issue, right? As our feet become flat and roll internally, we're going to start having medial knee pressure, right? Because these forces are going to go directly to the medial knee. It's also going to rotate the pelvis, so now you're going to have some tension and pressure down in the low back, some compression down the low back. So this may be what's attributing to his low back pain. We've already kind of instructed him on what to do for getting a better orthotic, probably a different shoe at this point, since those are a little bit worn down now. Getting some soft tissue work and some chiropractic adjustments to help with mobility and stabilization in the low back. We also talked about some pain right here during lifting. As we put his posture into a better posture right here to strengthen that, we noticed some reduced pain here into the areas that are compressed. We talked about some postural exercises to help with the neck and the upper back to help stabilize that, right? And we'll teach him a little bit more about what type of systems he can use to improve that. As we were explaining to him, some of the treatments that we provide here for these types of injuries are going to be chiropractic adjustments, right? So we adjust with our hands. We have electronic stimulation that we use here. We also have the little vibration tool that we use here. We have hot packs that we use here. We have a vibration machine up front. We have a massage therapist on staff. So lots of these different called modalities or treatments per se are going to help with these types of issues. Of course, with our recommendation for your at-home stuff like your orthotics, your at-home exercises, what you do at home is going to just strongly benefit what we do here for you for longevity, right? For long-term wellness, okay? So with that in mind, we're going to go ahead and get started. We'll set up for adjustment right over here, and we're going to, for you, I'm going to have you scoot about this much on the chair forward, and then just lean your upper back right here for me, okay? And we're gonna relax right in here, okay? Have you ever had an adjustment before?
Mm-mm.
No?
Never.
So first time adjustment, he does know a patient, which we won't mention on camera, so definitely has heard about us. Relax here for me. Very good, okay? Good. All right, how'd that feel?
Felt good.
Good? So a lot of people ask if those pops are real.
They are. Real.
Real. Yeah. Okay, feel that tenderness right in there?
Mm-hmm.
Okay, we're gonna get some mobility right in here. Relax right here for me. Very good, okay. Let me have you lay right here face down for me. All right. Okay.
That felt good.
That felt pretty good there?
That felt pretty good.
All right, good. We're going to try to get some range of motion. Now, a lot of questions like, how does the adjustment help with all the alignment or all the issues that we're finding? So adjustments are going to provide some segmental mobility and movement here, right? That segmental mobility and movement is going to ultimately help restore some function in the joint. Is going to help it move around. That mobility, that segmental motion is going to help flush out some of the inflammation that is created there. I kind of explained like when somebody breaks their arm and it's in a cast, it kind of withers and gets weaker. That's what also happens with the joint. When the joint's not moving the way it's supposed to move, it's going to get weaker. Well, a weak joint is going to end up making you more susceptible to injury, making you weaker, compressing the nerve roots. In the chiropractic world, we call those subluxations, and we remove those subluxations, chiropractic term subluxations, through chiropractic adjustments. Take a deep breath for me. Completely exhale. Very good. Take a deep breath. Completely exhale. Very good. Okay. Relax right here for me. We're going to get some movement here in the cervical thoracic junction. Good. Same thing right here. Relax here. Very good. Okay. Let's try here. Remember, we're dealing with the tightness right in here.
Mm-hmm.
We're going to try to get some good segmental motion in here. Take a deep breath for me. Completely exhale. Good. Okay. Let me have you lay on your side facing this way.
Facing this way?
Yep, right over here. Right there. And I want you to have your top leg like this. Keep your bottom leg straight. Relax your pelvis here. Okay. Give me this arm right here.
Mm-hmm.
Right there. Okay. Let's go right over here. Good. Take a deep breath. Completely exhale. Very good. Lay facing the opposite way. Get some good movement in there.
Yep.
Feel pretty good?
Definitely feel it better.
All right. Let's go top leg bent, bottom leg straight. Right now we're going to check the true test here in a second, okay? Right there. Take a deep breath. All the way out. Very good. Lay face up for me. Okay. I'm going to try something now, okay?
All right.
Lift both legs again, about 45 degrees right there. Straighten out your knees. Don't let me push down. Any pain with that?
Nope.
Nope. Did you have pain when we did it the first time?
Yeah.
All right.
A lot of pain.
Stay right there. And now much better.
Yeah.
Good. Okay. So this is going to show you, right, just based on an improvement of a symptom, that we can remove symptoms with chiropractic adjustments. We haven't tried any of our treatment modalities at all yet either. Relax here. Good. Okay. Let me have you lay back face down for me. Okay. And we're going to use a little machine here just to work some of this soft tissue here, okay? So he had some tenderness right in here. Tightness right here. Like some tightness right in the low back. We're going to try to loosen it up with the machine here. There's tenderness right here, right? Yeah. Tender here? Is there tender in there? Ticklish, okay. Tender here, ticklish over here, right?
Yeah.
Remember earlier when I was touching your back and I got to this spot and it locked up, it felt like it locked up your low back?
Yeah.
Okay, so that's what I was noting as I was palpating there as well. Good, all right. Very good, I'm gonna use a little bit of lotion there. Okay, a little lotion here. All right, let's have you stand up here for me. Good. Why don't you just try to move around, see how the low back feels there?
Feels a lot better.
How's your body feel?
It feels better.
Is it a little loose?
Yeah, more flexible.
Good. We're going to show you something here. Remember I told you about some postural exercises? So usually I recommend a postural exercise system, okay? I usually recommend this system here. It's called the Active Posture Pro, okay? This is not a commercial for Active Posture Pro. It's just what we recommend for somebody. It's easy and effective, okay? So it's going to have some, you can move right over here so you can see. There's like a head piece here with a, we have a door jamb there that helps extend that upper neck here. And then as you're pulling down on the bands, it helps bring the shoulders back here, an extension from a superior angle. So it helps build these muscles this way, which is what we're wanting for better posture for you, okay? So something right there is what I usually recommend. It also incorporates like some core stuff that you can use. You can use some bridges and pelvic type exercises to strengthen the psoas muscle. But for up top, this is what I recommend. There's a lot of exercises you can do in the gym that can help with that. But the thing that I like about this system that makes it very effective is it engages the neck and the upper back muscle at the same time, creating like kind of like a pulley system, right, to pull that posture, right, the neck and the whole back, to train that posture to be in what we're identifying to you. All right, very good, brother. Thank you very much. Great to meet you.